or emergency departments in general are facing an increasing number of patients coming in who are either accidental or purposeful opioid overdoses. And when we talk about opioids, we talk about anything of the opioid variety. So it can be pain medications, it can be heroin, which you could inject or you snort, or it could be one of the worst concoctions now, such as fentanyl or carfentanil, which are man-made. Opioids are great pain relievers. We've known about them for centuries. Morphine is as old as the gods. The reality is, though, that all of these pain medications or analgesics that are opioids work on the brain in similar fashion. And while they limit pain, they also work on the respiratory center. So they decrease the breathing of the person who's taking them. They also work on the pleasure centers. So most people feel actually fairly good after they take these medications. So that combination of a good feeling, decreasing pain, people have a tendency to take too many. And then what happens is that the breathing goes down. And that's usually the first and actually the most dangerous side effect of these medications. If you are unfortunate enough to find someone that has overdosed, the obviously first thing you need to do is call 911. And immediately after that, if we especially think it's opioids, you want to open their airway. And that means get them in a breathing position, tilting their head back, opening their mouth so that they can breathe in and out. Their breathing may be very slow or non-existent, but you at least need their airway open. And finally, if you have a family member or someone that lives with you that is a drug user, you want to look into having naloxone on hand or Narcan. It's becoming increasingly popular around the country to have this available in homes because it does work so quickly.